Well, hello there, everyone. My name is Pam Yankee Love, and I am the Director of Research and Evaluation at the Trager Institute at the University of Louisville. And we are so glad that you are joining us today. We are doing our Project Echo in partnership with the Kentucky Coalition for Healthy Communities, and we're glad that you have decided to do your Friday with us. We ask that you go in and keep your video on if at all possible. We do ask that you go in and mute yourself. If you have a comment or a question, feel free to raise your hand or use the chat function or unmute. If you're having difficulty with your sound or your video, please go in and click on the arrow next to your microphone. And you can go in and test your system. But there are ways to stay connected to this session. We ask that you go in and do that so we don't lose you. We do ask that you go in and put your name and your organization in your video square. The way you can do that is you can click on the three little dots in the upper right-hand corner of your video square, and a little drop-down menu will come down. You can click on rename and go in and put your name and your organization in there. It helps us to get to know one another in our community. Or the other way to do it is in the center of your screen down at the bottom. There's a participant list, and you click on the participant list, and then you can find your name and click on more, and then you can rename yourself there. So we ask that you go in and do that if you haven't done that as of yet. If you are unfamiliar with the University of Louisville Trager Institute for Public Bank Optimal Aging Clinic, we are an institute and a clinic. Our mission is to help individuals optimally age throughout their lifespan. We are a workforce development hub. So we are educating individuals in their professional programs and paraprofessional programs, infusing older adult information regarding age-friendly healthcare systems, as well as trauma-informed and integrated primary care behavioral health concepts into the minds of individuals from medical school and nursing school and residents and social workers and counseling, family therapists and PT, OT, lawyers, uh, nurses, dentists, dental hygienists. All of those individuals are part of various learning opportunities here at the Trager Institute. We also are trying to engage in practice transformation. The idea there is that we are taking traditional and non-traditional primary care entities, including ambulatory care, nursing homes, emergency departments, and trying to get them to think about how they can be more age-friendly, and helping them actually even receive a designation from the Institute for Healthcare Improvement, becoming a age-friendly healthcare system. We are also trying to transform our communities to be more age-friendly. And the idea there is that while we do spend, some of us spend a significant amount of time with our physicians and our healthcare systems, we also spend a tremendous amount of time in our communities. And so we are really trying to help our communities become more age-friendly. So if you consider the client and the caregiver and the family in the center of kind of a bullseye, we really are trying to help all of those concentric circles around that particular individual to be more friendly, whether it is our healthcare workforce or our practice sites or our community to be more age-friendly. We also provide Project Echo in collaboration with the Kentucky Coalition for Healthy Communities. And I believe, let's see, Justin, will you be offering the mission as it relates to that
Yes, I
part?
will.
Sure.
Thank you. So the Kentucky Coalition for Healthy Communities, our goal is to create community support systems for older adults in partnership with existing local coalitions and organizations. So inviting you to continually invite coalitions that you're a part of to join us. We would love to collaborate with them, but we're working to develop the workforce and concerned community members to empower our communities to become healthier.
And the Traeger Institute and the Republic Bank Optimal Aging Clinic are driven by a couple of different frameworks. One is the lifestyle medicine framework, which comes from the American College of Lifestyle Medicine. And it focuses on six pillars. And the six pillars are focused on, they're designed to prevent, to treat, and to reverse, in some cases, chronic disease impact. So the six pillars include whole food, plant-based nutrition, regular exercise, restorative sleep, avoiding risky substances, positive social connection, and stress management. And today we're going to be talking about a couple of different pillars in this regard. And then we're also driven here by the 4M framework. And if you're unfamiliar with the 4M framework, it was developed almost 2 decades ago. It's focused on age-friendly healthcare systems, and it was developed by the Institute for Healthcare Improvement and the John A. Hartford Foundation. And there are a variety of different manuals, regardless of the healthcare system, to help systems become more age-friendly. There are 4 pillars here and it's designed to help healthcare providers and the systems to really think about how we should be incorporating these 4 pillars, including what matters most: medication, mobility, and mentation, which includes mind and mood. Our upcoming session is July 17th. We'll be focusing on urinary incontinence. Then we're going to be taking a break in August. In September, we're going to be talking about retirement and mental health. In October, we'll be talking about falls risk. And in December, we have levels of care. So we hope that you take a picture of that. And if you're signed up through iEcho, which we hope you are, you will have access to all of these upcoming sessions. If you're unfamiliar with the Project Echo framework, it is a platform that was developed by Sanjeev Arora. He's an MD. He developed this in 2003. He is a hepatitis C expert, and he felt that patients were driving 200, 300 miles to see him. And so he was just giving one appointment to another individual, but wasn't increasing capacity. So he developed this telementoring platform. The idea is to move knowledge, not patients, and build local capacity. So there's a rhythm to Project Echo in the sense that there is a didactic, then there is case-based learning along with that, as well as what we're trying to do. Then we have a case in which we're trying to incorporate the didactic, and then we try to teach best practices in interdisciplinary team-based care. So it's a teach-all, learn-all kind of community. If you are interested in receiving an attendance certificate, you may receive a certificate for 1.5 hours for today's session by completing the evaluation at the end of the session. If you are a certified community health worker or a social worker, you must complete the evaluation to receive the continuing education. Our continuing education is provided if you're a certified community health worker. We have CEUs provided by the Kentucky Office of the Community Health Workers, and they will provide 1.5 CEUs. And for social workers, Brescia University has provided social workers through the CEUs through the Kentucky Board of Social Work. Now to our didactic presentation. We have Kristen Neises, who's going to be presenting on nutrition and social connection, the power of shared meals. And Kristen has been with us for at least, I think, 6 sessions. So if you have been a part of us, you may have heard her bio, but we're going to go through her bio one more time, just so you're aware who Kristen Neises is. She is a board certified nurse practitioner and lifestyle medicine professional, specializing in geriatrics and whole person health care. She serves as faculty at the University of Louisville School of Nursing and the Trager Institute, where she dedicated to advancing holistic care for older adults. Through her Geriatric Academic Career Award, or GACA, project, Kristen leads initiatives to initiate lifestyle medicine principles into education and practice, equipping healthcare professionals with tools to improve the health and wellness of older adults. Her work emphasizes an interdisciplinary approach, ensuring comprehensive age-friendly care. Outside of her work, Kristen enjoys spending time with her husband, their dog, and her family, and she loves practicing yoga, running, cooking, reading, and exploring new destinations through travel. So thank you so much, Kristen, for joining us. I'm going to go on and pass it over to you.
All right. Hello, everybody. So I want to start with a little bit of a disclaimer. See, got a little pup joining me today, which is appropriate because she's always around the table as well, waiting for things to drop for her. But as you might have heard, our movers just got here, and so hopefully no background noise, and hopefully she'll stay calm through this. But I'm glad to be here. Glad you're here. Um, Before we really jump into the presentation, I kind of want to share a little bit about my story, my family story. When I think about my family growing up, I think about food. Food was definitely, and it still is, our family's love language. And it wasn't always the healthiest food. So it was common to have biscuits and gravy for breakfast or lunch or dinner. And around the holidays, my papa, who really has inspired my career, he was my person. He was famous for his homemade fudge around the holidays. And so we would always gather together and help him make the fudge, and always a pie ready to go in case somebody dropped in, which was very common. And a lot of evenings we'd sit around the table and drink coffee, and sometimes eat pie at 8 p.m. And so I also have a lot of memories of picking wild blackberries and making homemade blackberry cobbler, and canning strawberry jam from our garden. And even sometimes if we had a surplus of fruit, we would make some homemade wine. So but looking back, it really wasn't about the food. The point was that it gathered us together, and we celebrated around the table. We grieved around the table. We caught up on each other's lives around the table. And even when life was hard, um, and the words didn't come easily, cooking for someone or sharing a meal together communicated our love in a way that words sometimes couldn't in our family. Um, so those meals nourished our bodies, but they really also nourished our relationships with each other, and they created this sense of belonging and connection that I didn't fully appreciate until I got older. So today, one of my favorite things is to host family and friends in our home. And as my husband and I prepare to welcome our first daughter in the next few weeks, I've been thinking a lot about those traditions and the kind of table that I hope that we're able to create for her, and continue for our family. And, as healthcare professionals, students, organizations, we spend a lot of time talking about what older adults should be eating. We talk about protein and fiber and calories. And those conversations are, of course, important, but I wonder how often we're asking another question, and that is, who are you eating with? Because sometimes what our patients or our clients need isn't just better nutrition. Sometimes they need connection. And so today I'd like to share why shared meals may be one of the most overlooked, but one of the most powerful interventions that we have for supporting optimal aging. So as I reflected on these memories, about my family's table, I started wondering why they have stayed with me for so many years. And, is it really the biscuits and gravy, or was it something a little bit deeper than that? And it turns out that the research suggests that it was much deeper. So shared meals don't just nourish our bodies, they support our emotional well-being, they strengthen relationships, they create a sense of belonging. And those benefits obviously don't disappear as we get older. In fact, they become even more important. So I'd like to explore 3 questions with you today. The first one is, what does the evidence tell us about the relationship between nutrition and social connection? Secondly, what do we know about congregate meal programs? Why are they so effective at addressing both food insecurity and loneliness? And then third, what can each of us as healthcare professionals, students, community organizations, caregivers, what can we do to help connect older adults with these resources? And my hope is that you'll leave here today with at least one practical idea that you can use with your patients or clients right away. So I want you to think for a moment about the last time that you ate dinner with people that you enjoy spending time with. Maybe it was with family, maybe it was friends, maybe it was coworkers. Chances are that you stayed at the table a little longer than you needed to. Maybe you ate a little more than you planned. You laughed, you told stories, and you left feeling full, physically and emotionally. Now think about eating that same meal by yourself. It's really a very different experience. And as humans, eating has always been a social activity. When we look throughout history, meals have brought families and communities together, and we do celebrate around food. We comfort one another with food, and we really build relationships around the table. But for many adults, older adults, that changes. So, whether it's retirement, loss of a spouse, declining health, difficulty driving, or maybe children moving away, can all lead to older adults eating alone more often. And what may seem like a small change in routine for them can really have a huge impact on health. So we often focus on nutrition by asking those questions like, are you eating enough protein, or have you lost weight? Those are important questions, like I said, but eating alone can really affect nutrition in ways that aren't immediately obvious. So people who eat alone often consume fewer calories. They consume less protein, and a more limited variety of foods. Variety of food means more nutrients. So if they're eating fewer variety, then they're getting fewer nutrients. And cooking for one can really feel like a lot of work. So their meals may become simpler, or sometimes they may skip those meals altogether. And then at the same time, you have social isolation affecting more than just the nutrition. So it increases the risk of depression, contributes to cognitive decline, and is associated with a higher risk of premature all-cause mortality. So that's why I really love the statement at the bottom. It's that solitary eating is a significant clinical risk factor, not just a social inconvenience. So I think that should act as a bit of a mind shift for many of us, when we often think of eating alone as just simply part of getting older. But the evidence does show us that it's something we should recognize and ask about, and then address just as intentionally as we would with any other health risk. Okay, so if eating alone is a risk factor, what's the opposite of that? And that's shared meals. So one of the things that I love about this research is that it reminds us that meals are about so much more than the nutrients, right? They become an intervention that supports multiple aspects of healthy aging. So first, there's nutrition, of course. We know that older adults tend to eat more and often eat more nutritious meals when they're eating with other people. They become something to look forward to instead of just another task to get through. And then secondly, shared meals reduce loneliness. So they create opportunities for that conversation and laughter and that human connection. And that consistency really can make a meaningful difference. for someone who spends much of their day alone. And then third, meals provide cognitive stimulation. So think about everything that's happening during a conversation at the table. You're remembering stories, you're following conversations, you're making decisions or sharing opinions. And those interactions really help to keep our minds engaged and stimulated. And finally, the shared meals provide a sense of belonging. They remind us that we're part of a family or a community or a group that cares that we show up. So that's why I think of shared meals as a lifestyle medicine intervention. Like Pam mentioned, they don't just address one problem. They support nutrition and mental health and cognitive health and social well-being all at the same time. So how big is this issue? So the numbers on this slide tell us that it's not a niche problem. It's something that we're seeing every day in clinical practice. So we know that many older adults experience food insecurity, and nearly 1 in 3 adults over 65 live alone. So those two things don't always occur together, but when they do, they really can create this perfect storm for poor nutrition and social connection or social isolation. And then loneliness itself has become a major public health concern because of the effects on both physical and mental health. In fact, the U.S. Surgeon General has described it as an epidemic because of its effects. One statistic that I think should really stand out is that socially isolated older adults are up to twice as likely to be malnourished. That to me is a powerful reminder that nutrition and social connection are so deeply intertwined. And as healthcare professionals, as many of us are, we often address these as separate issues. So we may refer someone for nutrition counseling or screen them for depression or isolation, but in reality, they're really often part of the same story. When I think about my grandparents' generation, there was almost always someone stopping by the house, dropping in for coffee or sharing a meal with us, unannounced. And for many older adults today, that's just simply not the reality. But the encouraging news is that we do have some programs already that address both nutrition and social connection at the same time. So what works? We know that congregate meal programs work. They've been around for decades, and they remain to be one of the best studied community interventions that we have for older adults. And what's unique about these programs is that they address multiple needs at the same time. So yes, they provide a nutritious meal, which is wonderful, but they also provide those other things, the connection, the conversation, routine, friendship, a reason to get out of the house, and even a sense of belonging. And the research shows us that that these programs improve both nutritional and social outcomes. Participants often report eating a healthier diet and reducing their nutritional risk. They report feeling less isolated, more connected to their communities, and having an improved sense of overall well-being. In fact, one survey from the ACL, the Administration for Community Living, found that nearly 86% of participants reported feeling better overall after participating in these congregate meal programs. And I just love that statistic. I always love these kind of statistics where, it's not just measured in um, calories or, a weight or some number like that, but it's these these humans who are stating that they simply feel better. That's the one of the best things that we can hear from these programs. And so I think back to those times around my family's table. And again, the meal mattered, but what made those evenings special wasn't the food. It was knowing that there would be people there. And congregate meal programs really help to recreate a little bit of that for older adults who might not have that opportunity every day. Okay, so we've established that shared meals work. The next question is where do we connect our patients or our clients? The good news is that we don't have to create these programs. They already exist in most communities. There are already wonderful organizations doing this work. Our role is really simply to know that they exist and to help connect people to them, right? So the Older Americans Act Nutrition Program is really the foundation of many of these services through our local area agencies on aging. Older adults can access the congregate meal programs and, when appropriate, home delivered meals as well. And for those individuals who are homebound, the Meals on Wheels provides more than nutrition as well. So every delivery of the meal is an opportunity for a wellness check, a friendly face, and just a little bit of human connection. And for some individuals, that volunteer may be the only person that they see that day. And then senior centers, faith communities are another incredible resource. Many people think of them as just, a place to eat lunch, but often they do so much more. They often have exercise classes, health education support groups, volunteer opportunities, games, and just some opportunities to build some good, meaningful relationships. And then for individuals experiencing financial barriers, programs like SNAP and the Senior Farmers Market Nutrition Program and CSFP, I believe, there are a lot of changes in some of the funding, from my understanding, and maybe someone who knows a little bit more about those programs can speak up in the chat. But I believe that we still have access to those funds, maybe limited, but still have that program in Kentucky. Some states do not. And then if you remember only one resource from today's presentation, I hope it's your local area agency on aging. I'm sure most of you are familiar with it, but it really is the front door to aging services. And if you're not sure where to start, referring someone to the AAA is always a great place to start. They can connect the older adults with meals and transportation, wellness programs, benefits counseling, and so many other services. All right. And so if these programs are effective and available, then why don't more older adults participate, right? So in my experience, and really the literature supports this, the barriers aren't just about the food, or they're usually not about the food. They're about everything surrounding the meal. So sometimes it's transportation. A person may be willing to attend, but if they don't have transportation, getting there becomes the biggest challenge. And then sometimes it's physical limitations, of course, mobility issues or hearing loss, vision impairment, or even cognitive changes can make that kind of new environment a little bit intimidating or overwhelming. And then sometimes it's financial concerns or uncertainty about eligibility. And sometimes it's something like stigma. So I've heard older adults say, well, I don't want to take resources from someone who might need them more, or that's, not for people like me. Others simply don't know that these programs exist, or they feel anxious about, walking into a room where they don't know anyone. But these barriers are modifiable, so we can refer to do a transportation referral. We can have a conversation that reframes the program as an opportunity for connection rather than charity. We can involve a caregiver, or simply just making a specific referral instead of just handing someone a brochure. Like, do the work for them, get them set up for this specific program. Those small actions really can make a difference between someone staying isolated at home and becoming part of a community. And then one thing that I encourage all of us to do is routinely screen for both nutrition and social connection. So we have lots of great validated tools for food insecurity, nutritional risk, and loneliness. But sometimes some of the most valuable information that we can get comes from simply asking some thoughtful questions. So that's what we'll talk about next. Okay, so one simple question that I hope that you'll begin asking your older adult patients, and that is, who do you usually eat with? Sounds like a simple question, but I think it may be one of those questions that can really give us valuable information. It tells us the answer, can tell us so much. So if someone says, I eat with my spouse every night, that's very different than someone who says, oh, I usually eat alone in front of the television. Or honestly, I just grab a bowl of cereal because, cooking for one isn't worth it. So that one question can cover, nutritional risk, any transportation challenges or loneliness, caregiver support, functional limitations even, or even depression. And then from there, we can move through our 4 A's, right? So first ask, screen for nutrition and social connection, like I said, as part of routine care. And we already asked about falls and medications, physical activity. So asking about food insecurity or nutritional risk and social connection should be just as routine. And there's lots of different tools that I've listed there. Second is advise. So I love the idea of prescribing social participation. That's really the idea of lifestyle medicine, is not just educating, but actually prescribing interventions for each of the 6 pillars of lifestyle medicine. So again, we routinely are prescribing physical activity because we know that movement improves health, but why not prescribe opportunities for connection? So something as simple as saying, I'd really like you to consider attending a community meal once a week. I think it could, benefit both your nutrition and your overall well-being. That can validate it as not just a social activity, but part of their actual care plan. And then third is assist. So don't stop at identifying the need, help them connect with resources. Again, whether that's just through the area agency of aging or one of the other resources that we talked about. Our role really is to help bridge that gap. And we don't have to know every resource ourselves. We just need to know where to start. And then finally, assess, ask at the next visit, and follow up, ask, were you able to attend? How did it go? What got in the way, to identify those barriers. And just helping to connect people with the resources that allow them to experience both, better nutrition and human connection. So as we wrap up today, I'd like to come back to where we started. So when I think about my childhood, I don't remember, all of the meals or exactly how to make the recipes that I helped bake. But what I do remember is that table, and I remember sitting around it with family. I remember a lot of the stories that were told over and over again, and the laughter, the conversations. Um, it really helped to build connection and in our relationships, and really helped us remember um, that we belonged. So I think that's exactly what many of our older adults are missing. So if there is one thing that I hope you take away today, it's that shared meals nourish more than our bodies. They support nutrition, yes, but they also reduce loneliness, foster belonging, they encourage conversation, connection, and improve overall well-being. And we don't have to solve the problem alone. We have lots of incredible resources that we mentioned. And our role is to recognize the need and help connect people with these resources. Sometimes, or we, as healthcare professionals or organizations, we really have an opportunity to make a real difference. So sometimes starting with one simple question of who do you usually eat with, that question can uncover so much. And then I'd like to leave you with a challenge for this week to identify one congregate meal program in your or community nutrition resource in your area, and then ask just one older adult, adult patient, that question: who do you usually eat with? And you never really know where that conversation might lead. As we get ready to welcome our daughter, I've been thinking a lot about these evenings around our family's table and the traditions that really shaped me. And more than teaching her about how to make blackberry jam or my papa's fudge, I hope to teach her that those meals really represented a lot more. That our table is always a place where people feel welcomed and valued and loved. And I think that's what we're really trying to create for our patients as well, not just healthier diets that I talk a lot about, but healthier, more connected lives. Thank you very much. And I think I have a slide with some resources or some references if you need those. I didn't put my contact information up there, but I can throw my email in the chat if anyone has any questions.
Yes, thank you so much, Kristen. That was great. And thank you for weaving your personal experience throughout it. And what a beautiful way to, go into maternity leave, talking about, your babe and the meals you're going to have with her. So thank you so much for that. Yes, are there any questions or comments or things that resonated with you? Let's see. There's somebody. Let's see. There's a few items in the chat. Let me go on and say. So, Susan, I don't know if you'd like to jump off mute and share your comment. Oh, I think Susan's driving. I think it'd be difficult. So let me share, unless Susan can jump off. I realized that some of the things that you talked about, who do you eat with living alone? Sometime I will eat a peanut butter and jelly sandwich or noodles because it's just not worth putting all of the effort into cooking. I think many of us that live alone or know folks that live alone understand that. So understand where people may have problem with nutrition in that aspect. Thank you, Susan, for that. Pam Smith indicated, thank you so much. This presentation really brought lots of memories back for her. Yeah. I mean, I just went on vacation a few weeks ago, and I'm an empty nester, so just cooking with my kids and eating with my children, as we got together on our family vacation really meant so much. Didn't really matter where we were, right? It was just those types of, social connection. So yes, I really, appreciate that. I think what really stuck with me is that when you said, eating alone is a clinical risk factor. thinking about that. We spend a lot of time talking about the nutrition quality and and the food insecurity piece. And maybe, some of our folks that work in congregate space or senior centers or AAAs really that they really zero in on that. Who do you eat with? But I wonder, I think it really does reinforce the idea that we really should be considering that and taking that in consideration because it does affect so many pillars of lifestyle. So yeah, Susan, jump on. Yeah. If you want to mute. Yeah.
I was just gonna say that that is where a problem is posed for people to try to have nutritional meals because sometimes it costs way more, sadly to say, to be nutritionally balanced than just picking up anything and making sure you have food to eat.
Mm,
So it's like you have to distinguish between that because um economically it's more cost effective if you just pick up little things and eat and instead of trying to do the nutrition thing, but it hurts your health in the long run.
mm, yes. That is true. Yeah, Kristen, I think it was this past year, maybe it was the previous year, you talked about nutrition and when you first talked about the nutrition pillar, and I think you talked about the cost of nutrition and how expensive that is, and I think you offered some recipes for things that would help in that regard as well. But yes, I understand that. Yeah, Bev, would you like to come off mute?
I think I'm off mute.
Oh, there you are.
So, yeah. So I loved her story about growing up because, and I'm way, way older than her, but I reflect back on my childhood and that we did always eat together. And I still remember it and I tell my grandkids about it. So I
Yes.
hope that, people do that as long as they can. The other thing I just wanted to mention is the importance of the senior groups, like churches and things where they have something, a couple times a month or where they offer programs and meals. I think that's a great outlet. The Norton Faith Health Ministry group could probably provide all the information of all the congregations, that do that. There's also, within our city, the Louisville Social Services, the Allie Woosley group, and they can provide lists of where all the congregate
Mm,
meals are.
mhm.
The one big barrier is, and I don't think any of us have the answer to it, unless hopefully somebody on the line does, is transportation. And so we continue as a community and a state to see transportation as an issue that results in social isolation and people not getting to MD appointments, no shows, cancellations, those kinds of things. So just, that's my observation from today. Great presentation, by the way. Thank you.
Well, maybe what we can do is we can also get Allie Woosley's the link to her resource manual and put that in our notes when we send the information out. Uh, the other thing is that did anybody want to comment on what Bev had to say? Any comments? Okay, let's see. Meg Kennedy said, I would love to talk about how shared food preparation helps people. Uh, I'm thinking about the sense of skill mastery and cognitive stimulation. Yeah, that's correct. Yeah. Kristen, you've been holding some classes in the culinary kitchen at our culinary medicine kitchen at Traeger, and you've probably witnessed that too. You've done it with medical students, I know, but you've probably seen the power of preparing together.
Absolutely. And then when thinking about older adults, thinking about some of those um, barriers in preparation. And, I know that you've worked with a student. I believe, is that training, is that available to the public um,
Which
on
training?
our learning management system for
Oh, yeah.
uh,
Yeah.
is
Yeah.
that
So
something?
yes, we had a OT student by the name of Helen Bandura who created a Thinkific course both for healthcare professionals as well as community members that actually helps older adults and their caregivers related to adaptive cooking techniques. And it communicates the various tools that can help individuals with different fine motor skills or different abilities that are affected because of chronic disease. And also how it is that you can set up the kitchen in a way that supports individuals of all different abilities to be able to participate in the food preparation. So yeah, if anyone is interested in that, we can definitely get you access to that particular Thinkific course. It's probably about a 25-minute course, but it really does share some ideas and make you think about how it is that you can support the preparation if there is some ableism issues or assistive devices, or how to adapt your kitchen in a way that would support participation from all individuals of all levels. Yeah. Um, yeah, and so Justin put in the chat about the culinary medicine. I think what we're going to do is we have a few more comments in the chat. Jennifer Williams said she worked in a AAA for 30 years and saw firsthand the amazing benefits that congregate meals and senior centers offer to seniors, and socialization is vital. Melinda said that Melinda Caudell reported that this presentation reinforced the small actions like sharing a meal or checking in on someone that can make a huge difference in the older adult's health, happiness, and sense of belonging. Um, and Kristen shared a little bit about the culinary medicine classes that she's teaching with medical students, and Justin shared something about that. Why don't we take this time now to go on and turn to our cases? We have Jennifer Montgomery with us and Justine Case, and we're going to do something just slightly different. We decided that it's summertime and we're going to do something a little bit unique. Jennifer is a program manager at the Trager Institute, so part of our Trager family, and talked about a long-standing tradition of basically congregate meals with her family. And she is willing to share her experience. So we're going to do kind of a little informal interview between myself and Jennifer. And then after that, we're going to ask Justine. Justine is an intern at the Trager Institute and is on the caregiver team, and has been really working with a couple of caregivers who have some meal experiences with individuals that they're caring for that has dementia. So we'd also thought about sharing a couple of different case examples in that. So thank you so much for being willing to do that. Jennifer, if you aren't aware of who Jennifer is kind of a master trainer for a diabetes self-management program and a master trainer for our Pearls program, which works with older adults that are living in the community who are presenting with mild depression. Jennifer is also a supervisor of students in our clinic and also works very closely with our clinical team on care management, case management, integrated primary care, and behavioral health integration as well. Is there anything I missed, Jennifer? There's probably a variety of things I've missed. Jennifer is like a Jill of all trades. So, Jennifer, thank you so much for your willingness to share. And we thought we'd begin by asking you if you could share your history of shared meals in your family and how the tradition started and how it evolved over time.
Yeah. So, thank you for joining us today, everyone. And thank you for listening to my story. I appreciate every one of you on the call today. So my grandmother really started those meals several years ago. My kids were little. She was also the caregiver for our children growing up, me and my sister. And so on Tuesday nights, we had softball practice with the girls. And instead of us having to go home and cook a meal and then rush them back out towards her house, because she lived out in the country and the kids went to school, got on the bus at her house and everything. Instead of us having to rush home, make a meal, come back, take the kids to softball, she said, why don't I just cook a meal? I'm retired. I'll just cook a meal every Tuesday night. We'll all come together. share the meal, and then you guys can go to the softball practice or the softball games or whatever. So that started off with like just me and my grandma, my kids, my sister and her daughter. And then it expanded to my brother and then his kids and then my mom and then my aunt and then cousins would show up. And so it just became this really huge thing where we all came together on Tuesday night, talked about talked about what's been going on for the week, what's going to go on for the rest of the week, and things like that. So it was an opportunity for her not to have to eat meals alone and an opportunity for us to kind of share what was going on in our lives with her.
Yeah. I love how that you added all the extended family members in that over the years. That's great. So have there been times when the routine was interrupted, either due to schedule or stress or conflict? And if so, how did you adapt or change things?
Yeah, so when she passed away at 83, I was adamant about not letting that die with her. It was an opportunity for me to see my nephews and my nieces and things like that every Tuesday and kind of know what they're doing and what's going on in their school and things like that. So I was in college at the time when she passed away and had a little bit more flexibility than others. So I took over the Tuesday night meals, and we would all come together out. My mom lived right next door to her. So we would just go to my mom's and do the meals because since she had passed away, her house kind of just sits there. We don't really engage in it. But so yeah, I would take over the mills. And then whenever I got the job at the Trager Institute, my mom was starting to retire and she was like, okay, I'll now take over the Tuesday night dinners. So there's rare occasion where, scheduling conflicts, the boys have sports or whatever the situation may be. And so we have to pause or not everybody can come together. But it's never fully ended. We always, even if it's just me and my mom and my aunt or something like that, we still get together on Tuesday night and have a small meal or whatever. And really, that's the only time that my aunt gets a home cooked meal because she refuses to cook for herself. So,
yeah, that's great. Able to continue the tradition or find someone else that'll, take it over if you can't. So, what has helped you maintain this shared meal tradition over time?
I think just holding on to her legacy.
Mm.
Family's huge for me. And we've all came together over the years to just help each other in any way that we can. And so just thinking we've had our times where we've quarreled and people have got mad at one another and they're like, I'm not coming back to Tuesday night dinner if they're going to continue to come or whatever. And it was like, I think we need to look at the bigger picture here. Because we did have that at one point in time where people were just, mad at one another and was like, I'm not coming back if that person's going to show up to Tuesday night dinner. And I was like, let's look at this from a bigger picture, right? This is something that grandma started. This is something that grandma took pride in. And now we're trying to keep this tradition alive. And it's not about you. It's about her and keeping that legacy. And so people got over it and came back to Tuesday night dinner. And who doesn't want a free meal that somebody else is cooking, right?
That's right. Are there ways that you have adjusted or would like to adjust your approach?
Absolutely. My brother doesn't like to eat very healthy at all. Like he would rather eat probably candy and donuts for dinner instead of a nice meal. So just trying to incorporate like small changes, like maybe instead of a full-on sugar dessert, like a cake or something like that, we might have a fruit salad or something instead. Just really trying to make those small modifications so that he's not like, oh, wait a minute, I'm not coming to Tuesday night dinner because it's always healthy, right? But just making those small changes so that he
Yeah.
probably notices, but he goes along with it. So
Then you can bring out your grandmother's legacy too if that doesn't work.
yeah,
All right. What lessons have you learned from maintaining this tradition?
family's everything.
Yeah.
And it doesn't have to necessarily be your blood relatives. We've had friends that have showed up on a Tuesday night and been like, "Oh, you guys are cooking?" And it's like, "Come on, man. You ride past here every Tuesday. You know that we all meet here on Tuesday night. Yeah, this isn't anything different." But yeah, sure. Get a plate, pull up a chair, have a meal with us. I mean, I've had my friends show up to Tuesday night dinner. My brother has a lot of friends that are still in the area and
Mm.
they'll come and show up to Tuesday night dinner. I've had distant cousins come from like past Corden, Indiana, because my family's
Oh,
from Indiana. So come every Tuesday night for Tuesday night dinner
yeah,
just because they know that that's a tradition and that's, so.
that's great. And then the final question is, have you accommodated different food preferences? You kind of already addressed that with your brother as it relates to that. Or needs without making you want to feel uncomfortable or singled out. Anything additional that you'd like to say about that?
No, I mean, so my mom has made it a thing where if your birthday falls on the week of Tuesday night dinner, she'll specifically make something as it's, like whatever's your favorite, that's what she'll make for that week, right? But she also knows there's a lot of things that my brother won't eat or a lot of things that my niece won't eat. So we have to kind of alternate and coordinate that situation because she's like, I refuse to cook 2 meals in one Tuesday night dinner. So we really have to be creative with what we choose.
Yeah, yeah.
Yeah.
There were 10 brothers and sisters that I had, and my mom was accommodating several dietary needs. I remember that. Yeah. The other idea is just to bring something that you would like to add, right, to the meal. So well, thank you, Jennifer. Thank you so much for sharing your tradition. I'm sure all of us were thinking about our traditions as when Kristen was talking about hers. I noticed that several people in the chat talked about that as well and connecting to that and their history and what they would like to continue with their family. So thank you for sharing your tradition with us. Um, and then Justine, I know that you've been working with many caregivers and that you were going to share just, some of your experiences with a couple of families, I think, about their traditions and it brings up some questions and some ideas to think about for
Yeah,
families with individuals with dementia.
absolutely. When this topic first came up, I immediately thought of two families I work with because they're very similar in age. It's a husband caring for a wife who has dementia, and one of them has a long-standing just family culture of preparing meals together and eating together every single night. And the other family doesn't have that. And so I just saw this very stark contrast where, as the dementia's been progressing for one of these families, one who doesn't have established meal times together, um, when I actually ask the question in the caregiver assessment, which we do, do you frequently eat meals alone?
Mm.
And it surprised me that this married caregiver was like, yeah, I do. I eat alone. Oh, you eat alone. Okay, well, does your care recipient eat alone? When does she eat? And it was like, oh, I just usually make her a sandwich or, something easy or reheat. And they don't eat together. And it's really striking to me, frankly, that this family, chicken or the egg, don't know. There's a lot more conflict there and a
Mm.
lot more frustration, anxiety, and challenge just in caregiving for this family. Where the family who has a long established shared meal where they make the meal, they set the table, they
Mm.
dine together, even though there is maybe the anticipatory grief and concerns over how to meet his loved one's needs and figuring out financially how we're going to make it and finding resources and all that, he and she have the benefit of shared mealtime.
Mm.
It's really very striking that even as one of this family that has shared mealtime faced some medical issues that were coming up for the spouse who has dementia, that she's actually been dealing with an aversion to eating. And it took some time to sort through what that was.
Mm.
But they still prepared meals together.
Mm.
Even though she was not interested in eating, she still got the social experience of contributing both to setting the table, chopping some vegetables. And so her husband kept that going just as a routine, familiarity, and connection. And so it was very striking to me as I was contemplating about just this workshop to have seen these two families where similar situations, like similar diagnoses, similar ages, both male caregiver for the female wife, but to have these very, very different experiences just socially and in terms of stress within their households.
Mm. Has there been any conversation with the family regarding their meal traditions in the past or meal traditions in the future of what they might want to do?
Not a ton, as most of my interactions are in case management. And so I'm just like, hey, what's going on for you? What resources can I help you
Right,
find?
right.
But it is definitely something that I've, tried to explore a little bit to see kind of, what can I do to bolster here, if anything. But it's something that is, as Jennifer was talking, it was really striking to me that in my own family, so frankly, my mother-in-law hosts every weekend
Mm.
extended case family, not every weekend, excuse me, it's the first Sunday of every month. She does case family dinner. And my mother-in-law is in her 90s.
Mm.
She's been doing this for longer than I have been in the family. And it brings out her cousins, sometimes her kids, sometimes grandkids. But there's this whole constellation of family friends that they've had over the years that have been part of caregiving for their children and vice versa.
Mm.
That they all come together. And it's been such an interesting experience to watch. It's not even the family who geographically are closest. Some people drive for 3 hours to come to case family dinners once a month.
Mm.
How striking it is for my mother-in-law to have this social engagement from a lot of her in-laws and from kids and grandkids and great-grandkids, but just from family friends that will come from great distances just to be with her and to be with one another. So
Yeah.
I just thought I'd throw that one out there.
Does,
And go ahead.
No, no, go on.
Well, I just wanted to also just say that Jennifer, as a pearls trainer, has actually trained me in pearls, and so I've had a handful of clients in that. And it's very striking to me that two of the clients I've worked with, that in pearls you make these goals each week for social activity, physical activity, and just a pleasant activity. And many of my clients are choosing their social activity is having a meal with friends.
Yeah.
That is both their pleasant activity and their social activity. And so this
Perfect
workshop has really brought it to mind how much it's really important. And then one other thought I wanted to share is that I had the very good fortune to get to study with Martin Prechtel. He's a native author. And whenever we would come together for these like week-long workshops, he would always say, look, if you're new here and you don't know anybody, say hello to whoever's next to you and please. And he would cross his hands over his heart every time. Don't eat alone. It's not good for your soul. And so it was just this inherent indigenous wisdom that it is important for us to be together to eat.
Yeah. Very good point. Any comments, anything that resonates with anyone as Justine was talking? Sharing some of the work that she's been doing with caregivers and specifically in the space of working with individuals with dementia.
Hi, I'll just add to this. When you think about congregate meals as a whole and like just us as human beings, for centuries and centuries and centuries of human beings being around, sharing a meal wasn't just, a nicety that we sort of engaged with. It was sort of a necessary function of the world in which we lived in. And I think as the modern world has sort of picked up pace, and we've done more things digitally or virtually, it has become less so part of the culture of a lot of cultures, not just ours in the United States. And so I think when we start talking about, some of the issues we have from a societal perspective of isolation, loneliness, some of our habits related to nutrition, where a lot of individuals are eating, more fast food. They're consuming, a lot of empty calories. They're not having, meals at home as often. I think this is something, we probably need to get back to, right? Because to your point, Justine, the family that you were speaking of who don't eat together, right? They've probably been doing that for quite some time, right? It was probably now it has become part of their dynamic that is how things work, right? And so really thinking about those overall health outcomes for that couple versus, the other individuals you talked about, or even comparing to, not to compare, but even, from Jennifer's experiences in her own family, just seeing how that sort of evolves over time and how we got to this point, I think is quite fascinating, and how we see that our nutrition is quite bad as well. So you see that social kind of intersection with more of the health related outcomes piece too. So that's my only comment, is that I always think that that's fascinating when we start having those types of conversations.
Yes. We have a comment from Lean in the chat. Lean, would you like to jump on and share your comment?
Sure. Can everybody hear me?
Yes.
Thank you for hosting this today. I'm joining you all as a third-year medical student. This is incredibly engaging and interesting session. I've never, been a part of something like this before, so it's really interesting to just be able to hear so many stories. I really enjoyed Justine's story, especially with the idea of togetherness and eating with others. And what I've been learning as a medical student is with the idea of aging and Alzheimer's, and the other story that was shared of having that routine, and how I feel like, the idea of isolation has in some way contributed to the progression of Alzheimer's and age-related dementia and age-related diseases of forgetfulness, because people are alone and because so many things have impacted our society, where people have these instances of, getting fast food or just being in situations where we have social media, that you're more isolated. And even as myself, as a medical student sitting in my room like 16 hours a day, I'm alone quite often. So yeah, it was very impactful to hear that story, especially because it's just a big reminder that we should try to spend more time with other people, because it's good for your brain and good for your memory.
And your soul, right?
Yeah, exactly.
Right. Thank you. Thank you for coming off mute and sharing that with us.
Thank you.
Other comments? Okay.
Can I say one more?
Please.
Just because you asked Jennifer about, how do you accommodate people who might have different preferences or dietary needs? Honestly, I have such a long list of dietary restrictions when people are like, oh, tell me what you can't eat so I can make you something. And I'm just like, it's okay. It's not going to happen. Even if I give you the list, it's dozens of foods long, and you won't realize that half of those things are in mixes you use. I just bring what I can eat whenever I'm coming to a communal meal. And there's like two foods that I can't even be in the same room as. I'll tell you about those. Just if you could ask everyone to leave those out of the meal, that would be great. But I take it on myself, knowing my needs are so vast. I just bring stuff to make sure that I have enough to eat and that I can share. And I know that in some cases it can be very isolating and alienating, and it's significant to have the host or organizer accommodate it. But just as someone who needs a lot of accommodation, I just skip asking for somebody else to cook like I need cooked. And so I really make a point, though, of taking pride and be able to make food that tastes good, that I can eat, and then showing people like, what? It can taste good without wheat and gluten and onions and cinnamon and garlic. How'd you do that? And then I talk about the herbs that I grow that I actually can eat and how delicious it is. And so I do think that there's something about, it's not just the function of eating, and it's not just the nutrition, though that's important, and it is the socializing. But like food is culture as much as music is culture.
That's
and
right.
having the opportunity, like that connection of, learning from a family friend, like how to use cardamom in place of cinnamon in my baking, for example. Totally different flavor profile, but it hits that like warm, sweet place, right? And it hits you in your nose and it's delicious. So I think there's a real opportunity to connect, yes, interpersonally and cross-culturally, and really like build this like network of closeness and of affection for one another through food. Um, yeah. So that's something that as a person who's had dietary restrictions for going on like 15 years now, and they're really critical, I just make a point of making sure I don't ask anybody else to carry the burden of it. It's too much. So, but I'm okay with that for
Did you
me
ever have
personally.
any host kind of recoil when, you said, well, I'll just bring something that I can both eat and
Um,
share with others?
Not, yes. They'll be like, oh, but I really want to feed you. I'm like, okay, but here's the list of restrictions. And I rattle it off. And I'm like, I'm only a
But they're
third done. Do
scared.
you want me to keep going? And they're like, no, you just do it. You do it. You're right. So for me, it's that way. But I also like, I work with a lot of families and patients who have these dietary restrictions, and it really can become a point of contention in a family. And so for some, it's really important that the host does everything for them as a point of reconciliation if there's hurt and like baggage there. So I think it just really depends on the family dynamic and where the individuals within that family system are in terms of including and understanding one another. Because I mean, it's a big deal. Like if you've got somebody who's like chosen to be gluten free because they need to, or is vegan, man, when I went through a period of time where I wanted to be vegetarian or vegan, and my mother wouldn't cook for me
Mm,
on principle because she couldn't figure out how to cook without those things in it, and she took offense that I wouldn't eat her food.
mm,
And
right.
so it is like food is culture. And so I think it's important to find ways to meet each other in the middle. But I mean, I'm decades into eating peculiarly.
Yeah.
So I'm fine with just showing up with my stuff.
Yeah. Like, thank you. Thank you so much for sharing that. Any final comments? I know that we are kind of into the KCHC time, but Justin is okay with us taking a few more minutes, I think, if possible. If there's anything else anybody else wanted to say or comment before we move into the KCHC? All right. Well, thank you so much. Thank you, Jennifer. Thank you so much, Justine. And thank you, Kristen. I think Kristen had to race off to deal with the movers, but thank you for sharing stories and sharing your experience and sharing those case examples with us.
All right.
Justine, I mean, Justin, if you're ready.
Thank you, everyone. So I'm just we're going to focus mostly on how we take this back into our communities today. So when I go through some of the resources at the end, I will share the PowerPoint in iEcho. So if you log into iEcho later today and you click on View Details for today's session, you will be able to find a recording and the PowerPoint that'll have all of the different upcoming classes and things like that. So I'm just going to focus today, just a reminder, really seeking to empower stakeholders and community members to provide hope and education for their communities. Already a lot of great sharing today, but what stood out to you and how are you going to take this back into your community and the people you serve? Any ideas?
I'll share. I think for me, I usually don't eat dinner alone because my husband and I always sit down together and have, our meal together. But thinking about, maybe establishing something with our friends to invite those people over on a certain day of the week, because I do have some friends who live alone. And so thinking about what's a good day of the week where we can all get together and do something to sort of share in that.
I'll
Any?
share.
Yeah, go ahead, Jennifer.
So I work really closely with older adults in the clinic at least 3 days out of the week. And I think whenever I'm engaging with them, I think that Kristen's question of who are you eating with is going to be something that I'm going to incorporate into my conversation with those individuals. And then just express the importance of finding someone to share a meal with.
Other ideas. So one thing that I'm aware of is that I'm watching what's happening with the state budget, and I am going to be strongly advocating to continue funding for congregate meals. I've been going to Highland Community Ministry a couple times a month and learning about their programming, and I always stick around for lunch. And I see the value of people eating together, and I see that, there are people there that are probably there for the food, and there's people there that are probably there for the community, and then a little bit of everything. And so I really see the value of it. So that's something that I'm going to, continually refer people to congregate meals, but also advocate for their continuation. Anything else anybody else wants to share? All right. Any upcoming events that you would like to share? Or we're going to be participating in the Metro Summer Concert Series as a vendor. It's on the third Thursday of the month. It parks around Louisville. So if you are interested in referring people out to that, reach out to me and I can get you the information. But I think that there's free lunch and ice cream for older adults over 55. So that should be a fun way to enjoy outdoor music and food. So kind of excited about that. Anybody else have any events you want to share or upcoming programming? All right. My Health Matters, and so does yours. These are some upcoming sessions on the Monday evenings from 6:30 to 7:30. I am particularly looking forward to Riley's presentation on bird watching Monday. I will make it a point to be there. And then for the rest of the month, Dr. Moisa will present on men's health on June 22nd, and Barbara Gordon will present on PTSD and older adults on June 29th. If you ever want to be added to My Health Matters, or you would like to present or see a topic presented, please reach out to Mona. Our diabetes self-management program, speaking of meals and the importance of diet, this is going to be a big part of the upcoming diabetes self-management program. You can register now to save a seat. June 25th through June 30th. There is an in-person and virtual option from 12:30 to 3, and then there is an evening session from 6:30 to 9 that's virtual only. But if you would like more information, please reach out, or you can look at the PowerPoint slides when I upload it to iEcho, and there's an interest survey, or you can call the number 588-3471. There will be new sessions starting soon for Flourishing Together. And we have, our programs that we talk about. If you, Pearls was mentioned today. We have our caregiver program. So we have lots of resources for older adults. So please reach out if you need additional services or like more information. If you are interested in learning about caring for older adults, I encourage you to join either our Optimal Aging Scholar program or our Integrated Primary Care and Behavioral Health Scholar program for behavioral health students and practitioners. Please reach out. Participating in Project Echo, our interprofessional case management experience, and Impact 4M training is required, and then we would invite you to participate in our Optimal Aging Conference next spring. So please reach out and I can get you more information. We've talked a lot about sort of the age-friendly healthcare concepts is the core of everything we do. We're working in 3 areas in Kentucky with our Flourish Care Centers of Excellence. We have steering committees in the KIPTA region, the Cumberland Valley Area Development District, and the Barren River Area Development District. So please, if you are in those areas and you would like to learn more, please reach out to Riley, Chandler, or Heather, and they can get you additional information and tell you more about what the great work they're doing in those regions. So just remember, we're working together to create an effective state coalition. Please invite your friends and other coalitions that you're a part of to really work with community members and community-based organizations to empower our state to become healthier and compassionate. We really work on practicing self-care. I love eating with other people, and I dislike cooking alone for myself. So thankfully, I have offered great opportunities to do this, and I hope you all are too, so we can create healthier behaviors for ourselves, our families, and our members of our community. So we have some great upcoming sessions. On July 17th, Dr. Kellen Choi will present on urinary incontinence, and then we start up on a new series starting in September. So hope to see you at a future session. If you are a community health worker or a social worker, you must complete a session survey in order to receive a continuing education certificate. Invited everybody. Go ahead, please complete the evaluation. Let us know what stood out to you today. We really appreciate your feedback and your thoughts on additional programming. So I hope everybody has a great rest of your day and a good weekend. I am going to stop recording. I will hang out if you have any issues with the evaluation. Otherwise, I'll invite you to complete the evaluation and have a great rest of your day.